We've heard about all these treatment options that are very specific to the protein and to this specific disease, and we started the segment talking about other differential diagnoses and neuromuscular disorders. Do you see any potential treatment options that are used for other neuromuscular disorders there, where you may be able to cherry pick some treatment options that have helped patients with similar but different diseases, where there may be some applicability to bring those treatments into SMA, or is it just such a specific genetic issue that the treatments are so tailor-made to those individual conditions?
So both, actually. So we are being able to choose our treatments based on the molecular specificity of what a patient's DNA tells us has gone wrong, and that's incredibly exciting. But we also can lean on other potential treatments that may help protect muscle stability and nerve stability from other diagnoses, although I see it actually the other way around. We are utilizing in clinical trials now some muscle stabilizing agents that might actually be applicable to some of our other patients outside of SMA. So we're using them in SMA clinical trials, but perhaps one day we'll be able to utilize them in patients with, for example, Duchenne muscular dystrophy. And so I'm excited that a lot of our story is starting with SMA, which is really a place where most people didn't expect the story would start. Right. And to see it branching from there outwards, it's really exciting.
What about the future in terms of trials? You've talked already about the cocktail, the combination. Easy to compare nothing with something, but do you think there are benefits to giving a cocktail of drugs, maybe oral and intrathecal treatments? And what is the concern about the risk of giving multiple medications and cocktails and potential side effects in terms of drug metabolism, for example?
So those are some of the unknowns that need to be answered. Are there adverse effects that could be identified, and if patients are receiving more than one treatment? And so that's where I really think that we need to do our due diligence and evaluate these. When we look at each of the medications individually, there are risks individually with them. And if we can look at how the body is processing these, that may give us some insight into knowing the risks that may come with utilizing them in combination. The other clinical trial that had a major impact on our practice was what's referred to as the Nurture clinical trial, and that was looking at treating babies who had been identified early just through genetic testing, so they weren't showing symptoms yet. And those babies received treatment at less than 6 weeks of age. And now, looking at how they have grown and developed over time, I believe that on the last data cut, the average age was about 3, and 88% of those kids are walking. And so that tells us that early intervention is key here. And so my goal is to be able to help facilitate diagnosis and early treatment while continuing to pursue some of these other avenues of research opportunities in the future as well.
And also, so often on Cure Connections, we talk about clinical trials and the future treatment options for patients where treatments are not FDA approved, and lots of patients, understandably, are very frightened by the word clinical trial. Nobody wants to think that they're a guinea pig. Right. But if you have a child who's got SMA and no treatment is available, and then there's a potential treatment that can have such a dramatic improvement, then it's really a no-brainer, isn't it?
Mm-hmm. Mm-hmm. Yes, I find that my patients with life-limiting illnesses are much more readily enthusiastic about participating in clinical research trials. I also try to reassure them that it is not within my wishes to offer them something that I don't think might have the potential to benefit them. And so that comes back to good clinical practice and our ethicism as physicians to make sure that what I'm offering them is something that I truly think may be helpful. And to be upfront about the potential for them to receive something like a placebo. I can't guarantee that you will be getting this medication if you're participating in a clinical trial, but my hope would be that you would be able to receive it at some point if it is proven to be helpful.
So for centers of excellence across the United States, I'm sure you're sharing information with other countries as well. Are we well ahead of the game in the United States, or are there other exciting areas of research outside of the US?
So actually, I think in the realm of SMA, we've done quite well here in the US. And so, unfortunately, the treatment that Sebastian is getting is not approved in all countries in Europe just yet. I'm hopeful that it will be, but we were quite early in that, and that was a phenomenal opportunity for our patients here. But we would like to see that become an opportunity for patients worldwide.
So thank you both very much for such an enlightening, informative session on SMA, and it's wonderful to hear that you're doing so well, Sebastian.
Thank you.
And it's really wonderful to hear that there are central sites like SMA.com where patients can go to get information, and hopefully you'll be inundated with many requests for further advice for patients who are watching this session. Thank you so much.
Thank you.